Good afternoon. So around the world, there are more than 5.5 million cases of COVID-19 and more than 346,000 deaths. We're particularly paying attention to Russia and Brazil, with large increases of cases. Across Canada, more than 85,000 cases and more than 6,500 deaths. Certainly, the areas of concern remain Ontario and Quebec in this country. Overall, in our cases in the country, 17% of them are hospitalized. 22% of those hospitalizations have ended up in the intensive care unit, and 4% of those are on ventilators. There continues to be ongoing testing in PEI, but no new cases of COVID-19 to report here, despite the broad testing. We have 376 new negative tests since Friday. Always a reminder that if we have any symptoms, or if you have any symptoms related to COVID-19, please contact your doctor, nurse practitioner, or call 811. I thought I might mention that on our 1-800 line that it comes into the CPHO, there have been 6,995 calls that have been responded to. We've had also over 6,000 people in self-isolation since we started our Operation Isolation last month. Over the last few months, we've learned a great deal about COVID-19, this new strain of coronavirus, and we continue to learn more every day. But it's also important we don't forget some of the basics. COVID-19 is primarily spread from person to person by droplets. And these droplets can come from coughing, sneezing, or speaking forcefully, or singing, actually. And this is why the physical distancing, or staying 6 feet apart, is so important. We've talked about it. If you touch something and touch your mouth, your hands, your eyes, that's how it can be spread. It does not shoot across the room as a virus to hit you. In that way, we know how we may get the virus. It also doesn't soak through your skin on your arm. And so it's really important we continue to use enhanced cleaning measures so these droplets don't remain on surfaces where another person can touch. And it's also about the containment of these droplets. When we talk about wearing a non-medical mask in spaces where physical distancing cannot be maintained, like public transport, very important. So we're now into a few days into phase 2 of the Renew PEI Together plan, and we've seen more businesses open to the public, and soon we'll be into phase 3, which will include even more. But just because these are options, it doesn't mean everyone will feel comfortable in these public spaces yet, and that's okay. It's important to consider your own risk and others' comfort level. For instance, my mother might not go to the grocery store because she has someone who will pick up her groceries for her because she feels that that still is the safest option for her. And this also goes for businesses. Even though they are permitted to open on a certain date, doesn't mean that they may all feel comfortable and ready to do so. And it is up to an individual business to make that decision. And each business must but have an operational plan in place outlining the changes that they are going to be making in their business to follow public health guidance to protect their employees and the public. It's a reminder for anyone returning to Prince Edward Island, they require approval through public safety and must have a self-isolation plan before arrival. Residents who are returning to Prince Edward Island do not need a pre-approval travel necessarily, but they do need to self-isolate when they return. And this pre-approval travel has to be done before entering PEI, and it is not something you can do once you arrive. And the self-isolation plan has to outline the support you have in place, so everything you may need in that 14-day period of self-isolation, how you will be supported in doing so. And of course, you will be called during those 14 days. And that is what is going on now, and that's going to continue. And I know there have been questions about the seasonal residents, and I think by the end of the week we will outline certainly more details about what that would look like, but it will be, applications will be considered after a certain date, but there'll be a risk assessment process that will consider not only where people may be coming from in this country, but our capacity to do that operation self-isolation, how their self-isolation plan, how good it is and firm it is, and even whether testing may be an option or a requirement for them as well. So these are the things that we are going to work through and be very careful, and this could take a longer period of time. We will not want to, for instance, jeopardize our capacity with Operation Isolation based on our intake of people coming into PEI. I think it's important to note that there are exemptions for some of the self-isolation requirements. And these are PEI essential workers who travel off-island for work, and they may be exempt from self-isolation. And there's two groups, really: essential workers who are traveling off-island for work within Canada and the U.S. who are home in PEI for less than 14 days, and those who are here for more than 14 days. And those who are home in PEI for less than those 14 days, they can be tested weekly for COVID-19, but the first time they're tested, they have to self-isolate waiting for the results. And if they're still in PEI 7 days later, they will be tested again. And those who are home for more than 14 days between work periods also can be tested on arrival. And they will again be asked to self-isolate until results are back from their first test. And we're trying to make sure people are safe, that returning islanders are safe, but also that we minimize the risk for the community. But we recognize that people who have to travel back and forth for work are having challenges ever getting off of self-isolation, and what that impacts, the impacts that has on their family. And this will occur every time they enter the province. I'd like to thank the pharmacists and pharmacy staff who've remained open and accessible during this challenging time. Drug supply limits for clients were put in place in March to help to stabilize the drug supply. Now these limits have been removed, and we ask that islanders access reasonable supplies of their medication. There's no need to stockpile medication. And thank you to all islanders for your cooperation with regards to the drug supply in the last couple of months. And teenagers, I've been asked at different times to highlight teenagers. And it's important that they're able to gather even in small numbers, but they really need to practice physical distancing, and that is key. I know as grad season approaches, many young people want to get together and celebrate. And I know it's difficult, and as a parent of a teenager, I know we need to speak to our teenagers about this and caution them to be careful in these types of situations. As we continue to move through through relaxing some of these restrictions, it's important that we don't forget the basics. Physical distancing, good hand washing, avoiding touching our faces. I'm always conscious I don't want to touch my face when I'm up here. These pieces are extremely important, perhaps even more so as we relax our restrictions. We know we have many people coming in and out of this province right now who are essential workers, for instance. We need to all practice this. This is the way we will be having to live for the next number of months. We're all learning together and navigating through this situation, and we'll be trying to do it as slowly as we can, but also conscious that we all have to move forward. And I think together we are nearing and approaching something that we will have to, a way we have to live in the months ahead. And we thank you all, and I appreciate all the efforts we're making together. Je vais juste, peut-être en français, juste quelques mots. I'll mention a few things in French, just highlight a couple of areas. Bonjour, nous n'avons toujours pas d'indication du virus à l'île et nous continuons de beaucoup tester. Et encore, si vous présentez des symptômes, s'il vous plaît, allez vous faire tester. Et depuis des mois, nous avons beaucoup appris sur le virus et nous continuons à en apprendre beaucoup tous les jours. Cependant, il faut retenir les pratiques de base que nous avons adoptées pour notre quotidien. Le COVID-19 est propagé par des gouttelettes, donc c'est important si vous éternuez, toussez, vous parlez, même chantez. Il y a des gouttelettes et c'est donc pourquoi nous nous répétons souvent de l'importance de la distance physique. Ça fait quelques jours de la phase 2 du plan provincial. Et plus de commerces sont ouverts et lorsqu'on arrivera à la phase 3, il n'y en aura plus. Je sais que pas tout le monde sera à l'aise en public et c'est correct. Mais c'est important de se souvenir le risque et le confort, autant pour vous même que pour les autres. Un rappel à tous ceux qui viennent à l'île, vous devez avoir votre plan d'auto-isolement en place. C'est quelque chose que vous devez avoir en place avant d'arriver. Et vous ne pouvez pas le mettre en place à votre arrivée. Le plan oblige ce dont vous avez besoin pendant 14 jours. Merci à tous les pharmacies et leurs travailleurs qui sont toujours ouverts et disponibles durant la pandémie. Des mesures de limitation de l'offre et la demande de drogue ont été mises en place au mois de mars pour aider à stabiliser la situation. Dorénavant, les limites ne seront plus en place. Cela dit, je vous demande toutes d'être raisonnable avec votre achat. Vous n'avez pas besoin de remplir vos stocks. Et merci en avance pour votre coopération. N'oublions pas ce que nous avons appris jusqu'à date, même si nous sommes en train de renouveler l'île. C'est-à-dire la distance physique, la bonne hygiène, rester à la maison quand on est malade. Ce sont toutes des actions importantes et je dirais que c'est encore plus importante face à un déconfinement. On va continuer à apprendre ensemble, de passer à travers cette situation ensemble et tranquillement, mais certainement, on va y arriver et ça va bien aller. Merci.
Thank you. Well, good morning, everyone. This week, additional health PEI services are being reintroduced, and some of those who've already restarted have increased the number of patients they'll see as we continue with a phased approach. Our services reinstatement team is working with our healthcare providers and the different divisions across health PEI to look at phasing up their approach to services. Some of the areas that have started increasing procedures and appointments include the surgical services at the Prince County Hospital and Queen Elizabeth Hospitals, our provincial laboratory services, so for blood draws or venipunctures and other tests, our diagnostic imaging departments across the province, and some of our screening programs and endoscopy services, as well as some primary care services. While most of these services are still being offered at less than full capacity, Islanders will now be receiving more of the important health care they require. Services will remain at this current level of this week until at least June 12th for the most part, as we look at this phased approach, keeping in mind the requirements for physical distancing between patients, enhanced cleaning, and all of the other precautions Dr. Morrison has spoken about. Precautions are being taken to limit the number of patients in waiting rooms, to ensure appropriate scheduling of patients and clients, to avoid having too many people at one place and at one time. Like any other of the businesses who have an operational plan, we needed to establish those as well. So this has meant some changes in practices of moving from a walk-in type appointment to more booked appointments in some service areas. All services are being monitored to ensure we maintain the capacity to respond to future waves of COVID-19 and PEI, and include the ability to go back to essential services quickly if our response level changes in the province. As a reminder, patients will be contacted by Health PEI for their specific healthcare provider to rebook appointments. And also, please remember, if you are sick with any symptoms of COVID-19, it's very important to make our providers aware so that infection prevention and control measures can be put in place to protect other patients and staff. Long-term care visiting, I want to mention that we do expect to make changes to visitor restrictions at long-term care following the changes within the public health order and working with the Chief Public Health Office as well as our private nursing home operators. We continue to assess the protocols for public long-term care homes as well as our other services across Health PEI, and we do understand the difficulty this situation has presented for residents and their families and friends. We will provide more details on this to Islanders on Thursday, but initially I can share that we will be starting looking at designated visitors having scheduled visits and outdoors if possible. Our compassionate visiting still remains in place, and we continue to look at ways that we can further support families through those situations. Our cough and fever clinics continue running 7 days a week. And yesterday we saw 66 patients in Charlottetown and 50 in Summerside at our clinics. A reminder that anyone who has symptoms such as new or worsening cough, shortness of breath, difficulty breathing, fever, chill, sore throat, runny nose, sneezing, congestion, headache, muscle aches, unusual fatigue, or sudden loss of smell or taste, to please contact your family doctor or nurse practitioner or call 811 to arrange an appointment at the Cough and Fever Clinic. When arriving at the clinics, please remain in your vehicle until you're notified by staff. And remember, anyone with an emergent or urgent health concern to please call 911 or visit a nearest emergency department to be seen. Thank you.
Great. Thank you, Mariette. And we'll open it for questions.
Brian Higgins, CBC. Thank you, Mariette.
Yes, good morning, Dr. Morrison and Nurse Dowling. I'm wondering about the changes about the long-term care visits. What sort of, can you tell us more about those changes to protocols for visiting, and what will the stages look like in addition to being outdoors and things like that?
Initially, we're looking at outdoors, Brian, and then we will be putting precautions in place for physical distancing between residents, and residents will remain on the grounds of our facilities. Also protection in place for visitors, such as wearing masks. And so really our homes are looking at making those plans right now to see what can be facilitated with the different areas that might be available in the homes. Where Islanders are residing, and that will be the initial piece, and then we'll be looking to further expand that to allow people to visit indoors if possible with physical distancing as well. So there's lots of planning and shifting of space within some of these facilities to try and accommodate this as safely as we can, and the visits will be scheduled at the outset.
Great, thank you. And a follow-up question, if that is possible, about the drug supply. Can you tell us more about, it had been 1 month, and how is that changing now in terms of access to prescription drugs?
Well, I think it's changed now that as prior to the pandemic, people had the ability to get up to 3 months supply at a time. And so those restrictions were put in place because of the drug supply globally to make sure that everyone could at least get what they immediately needed, as opposed to someone getting 3 months supply and someone else not having any. So now the drug supply has become more stable, and so we've been able to lift that restriction because there is supply so that people could go back to receiving their regular 3-month supply if that was what they were getting in the past. That's my understanding of the changes.
Thank you.
You're welcome.
Louise Martin, CBC.
Oh, hi, good morning to you both. I think this question would be for Dr. Morrison. Is it still the public health office employees or health PI employees that are doing, the check-in calls for people self-isolating? We were told, or I just got a message saying that an employer had 2 people in isolation, and on May 22nd, we're informed that that would be the last call from Health PEI, that there would be a company taking over or contracted to make those calls going forward, and they hadn't heard from them since May 22nd. So I just wanted any clarification on who's still making those calls and maybe how many calls are still being made.
Yeah. Hi, Louise. So the calls that for Operation Isolation actually have been, although sort of coordinated out of our office, have been done with certain people who were at Access PI, some people who were at Department of Education. For instance, we had some people who worked in library staff, so we had different people making those calls. And starting on Monday, it went to a third party, a company called Vision Research Inc., who has gone through some of the training in terms of, and of course the script of what they need to ask people in self-isolation. So if there's someone that hasn't been getting calls, certainly we'd like to know about it. But understanding that there was a transition day there. So that, because some of the people who, for instance, who are working, helping us with the isolation calls are also being called back to their normal jobs as the government opened up. So we are making calls for, I don't know if I have it here, but certainly between 2,000 and 3,000 calls a day that we're making, and so that will continue with this company.
Okay, thank you. Thanks for clearing that up. And we're also working on a story today on religious gatherings, and I understand that they may be able to resume as part of Phase 3. So I just wanted to know if that's still the plan. Maybe can you explain what you see as the level of risk with people going back to church? Maybe what are the big things that will need to happen to mitigate that risk?
So we're also, we're not working on a story, but we're working on the faith gathering guidance today, and I think they're meeting about it as well today. We've had certainly spoken to some of the faith leaders, and we've heard from many as well. In this next phase, indoors, it will still remain small numbers of 15, and outdoors 20. The mass gathering number will not increase on June the 1st, and recognizing that certainly faith gatherings are challenging with very small numbers. But that number is going to be looked at. We've talked right from the beginning about that some of those mass gatherings, with including religious gatherings and faith gatherings, would happen a little bit later. If we start getting up to larger numbers of 50, 100, certainly we need to keep a manageable number so that we can do contact tracing on. And it's also been often in mass gathering settings where outbreaks have occurred. So whether when things start back in terms of faith gatherings early on in small numbers, it will be the same principles about physically distancing, washing hands, enhanced cleaning. And then we anticipate likely by the end of the month, by the 1st of July, that number will increase. And that will certainly help some of those faith gatherings continue it's a real need out there to address the faith gatherings, and we've heard from many individuals and faith leaders about that importance, but trying to balance that risk as we go forward. And it's about how many people come at the same time for the same period of time. It's and when they are doing faith gatherings, one of the big changes will be not singing. Really, our biggest choirs in our province are our congregations, and recognizing that there's a spread even more significantly with singing and that forceful projection that happens with the virus.
Thank you so much. Have a good afternoon to you both.
Thanks, Louise.
Allison Jenkins, The Guardian.
Yes, hello. I have a question. I believe it's for Marian Dowling. It's regarding the COVID-19 units that are in development for the Prince Edward Home and for Somerset Manor. Some families have gotten word that their family members might be affected, but they have not found a lot more information about how it's going to go, and there's no sort of written plan that they've received. Just wondering what the latest is on the COVID-19 units at the long-term care home.
Hi. We do have a plan to look at establishing specific areas within both of those homes as part of our long-term care outbreak management plan across all of the facilities within the province, both public and private. Right now, we're looking at an initial place where long-term care residents who don't require hospitalization but do need to be kept isolated from the rest of the residents, just like anyone else who's self-isolating at home if they were positive with COVID, can be cared for. So if they require hospitalization, they would go to hospital. Right now, we're looking at initially establishing a unit separate from the Prince Edward and the home in the Somerset Manor location. But those COVID units, if you want to call them that, within those two nursing homes are also part of our plan if there were to be an outbreak within our facilities. But right now, we're in a good place of planning for the other unit to be established more quickly so that if there were to be an outbreak, we could use that facility or that location first before having to move any of the residents within either of those other homes.
Okay. Rachel Collier, Eastern Graphic.
Hi, my question is for Dr. Morrison today. And from tracking those who need to self-isolate upon arrival to PEI, I'm wondering if you would know the number of temporary foreign workers that have arrived on the island so far this season.
Hi, Rachel. I don't have that number in front of me, but I would, and I certainly can bring it on Thursday. I would think it would be a couple of hundred, but I don't have that number in front of me. But they are all certainly when they arrive, and we've talked about this here before, Rachel, when the temporary foreign workers arrive, they are self-isolate and then are followed by contact or by public health nursing, and then they are all tested prior to them going to their employers.
Thanks for that. That's all I have today. Thanks.
Carrie Wynn McLeod, Ocean 100.
Hi. Good morning. I just have some questions for either of you that may be able to answer. Of course, everybody concerned with the seasonal residents and being able to come. Now that Vision Research is monitoring those 2,000 or 3,000 calls per day to those in 14-day isolation, are they able to see the exact locations of the cell phones of those people, because of cell towers, etc.? So they really know if they are, whether they are supposed to be or not.
Hi, Carrie Wynn. No, I don't believe they know exactly where the cell phones are, if they're using cell phones, where they are. But they ask them quite a few questions, and they call them at different times of day. And really, we have had very good compliance with self-isolation in general, and that has been the case for Islanders and others who've had to self-isolate here, who are coming for various reasons. And they of course, I know Islanders, when they return from travel, they don't want to get sick. They don't want to make their family sick, and they certainly don't want anyone else to be sick on Prince Edward Island. And that's true right across the country too.
Okay, thanks. And just another update, because the weather has been getting so much lovelier over the last few days, on that toll-free line of people reporting, things, have you seen an increase in the number of calls of coming in regarding infractions on the protocols that are in place?
Hi, Karen. We've not seen a large increase in the number of people calling to report different infractions. I'm just looking to see if I had brought the total number of infractions, but and I don't have that here, but it's not, certainly from the reports I've had, I have not seen a big increase. I think in some ways being outside, and if we're able to keep physically distanced, I think that's a good thing. But we haven't seen a huge increase in number of reports. But we're happy to take concerns when people let us know, or if the gatherings are too big, people can let us know, and that'll be important going forward. And sometimes it's just a matter of people aren't aware, but we'll continue to do that balanced use of authority we keep talking about, but they are complaints are then referred on to enforcement. I believe there've been 19 charges laid, and certainly well over 200 warnings altogether. But I can bring those numbers as well next time.
Super. Thanks so much, and happy birthday tomorrow.
Oh, thank you, Carrie Wynn. I'm not sure how you knew that, but thank you.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Première question pour vous, très simple. Pourriez-vous traduire en français la réponse que vous avez donnée à Louise Martin concernant les rassemblements religieux? Est-ce que, si je comprends bien, les rassemblements religieux vont être possibles avec la phase 3, mais avec un nombre très limité, et vous allez augmenter ce chiffre au fur et à mesure des semaines et des mois qui vont passer?
Bonjour, c'est exactement ça. Les rassemblements religieux sont annoncés pour commencer phase 3. Et je sais que ils ont fait des choses par comme virtual déjà, mais en commençant, pour la phase 3, c'est très limité, numéro 15, nombre de personnes en dedans, la distance physique. Et puis, j'imagine, les 3-4 semaines qui suivent après ça, ça va être jusqu'à 50, j'imagine. Mais il faut commencer tranquillement avec ces rassemblements. On sait partout au monde, c'est les rassemblements religieux ou avec les sports, des événements sportifs ou de musique. Ils ont des rassemblements comme ça qui ont un risque de transmettre le virus. Alors, il faut commencer avec les nombres un peu plus petits. Et j'espère que tout va aller bien et puis ce nombre va augmenter dans les semaines qui suivent.
Un follow-up pour vous, Dr Morrison. Vendredi, c'était le début de la phase 2 avec la réouverture des salons de coiffure et d'autres magasins. On est peut-être 4 jours après vendredi. Est-ce que vous avez constaté quelque chose, des irrégularités? Est-ce que vous êtes satisfaite de ce que vous avez vu durant la fin de semaine, de voir les insulaires de retour dans les magasins? Est-ce que les gens ont vraiment respecté les règles? Est-ce que vous êtes un petit peu plus rassurée par rapport à vendredi où vous aviez dit que vous étiez toujours inquiète?
Merci pour la question. Peut-être 2 commentaires. Je suis pas allée moi-même, mais j'ai des personnes qui me racontent. Il y a des magasins qui sont très, très bien organisés, qui suivent les règles, qui essaient de protéger leurs employés, protéger le public. Alors, ils sont vraiment remarquables qu'ils essaient de faire tellement bien les choses. Je pense qu'en général, les insulaires suivent les directions parce qu'ils ils veulent se protéger. Mais je pense, parce qu'on n'a pas les cas actifs ici à l'île du Prince-Édouard, je veux peut-être dire qu'on doit être encore vigilante, faire attention, de ne pas oublier que les mesures sont en place pour une raison. Alors, je pense que je vais être un peu inquiet pendant des mois et mois qui suivent, mais en général, je pense que les gens comprennent qu'est-ce qu'on doit faire.
Parfait. Merci beaucoup.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. Quand je vous ai écouté parler en anglais, je vous ai entendu dire, et je voudrais juste vérifier que la distance physique devrait continuer pendant encore plusieurs mois. Est-ce que c'est bien ça? Est-ce qu'on est parti pour avoir ça toute l'année?
Laurent, je pense que j'ai mentionné l'autre jour, avec tous les pandémiques qu'on a eues, il y a toujours une deuxième vague de cas. Alors, on prépare vraiment déjà pour une deuxième vague. Alors, on sait que partout au monde et au Canada, il y en a encore de COVID-19. On pense on va avoir notre vague ici. Alors, les mesures qu'on met en place maintenant vont nous protéger pour prévenir des cas de futurs. Et peut-être qu'on va avoir pas une grande vague cet automne. Si on commence maintenant à suivre la distance physique et vraiment, jusqu'au moment qu'on a un vaccin, je pense qu'on va avoir des mesures en place pour nous protéger au mieux que possible.
Et j'ai juste alors un follow-up sur cette question. On voit dans plusieurs pays qu'il y a des débats sur des applications pour les téléphones de contact tracing. Est-ce que développer une application comme ça sur les téléphones, est-ce que c'est une piste qui est étudiée au Canada?
Oui, on est en train d'être partie d'un groupe national pour regarder les aspects de contact tracing, les applications de contact tracing. mais il faut que la majorité des Canadiens participent. Je sais, ils ont essayé un peu en Alberta. Alors, on fait attention à ces applications, mais c'est encore assez quelque chose qu'on essaie de comprendre un peu plus. Et peut-être au temps de deuxième vague, ça va être quelque chose qu'on va faire et avoir en place, mais je ne suis pas certaine à ce moment.
Merci.
Thank you. I just might translate the last little bit in that I can remember in English. I was asked about how long this physical distancing may continue, and I think I mentioned it before. There's never really been in the history of pandemics a pandemic that didn't have a second wave. So we do anticipate a second wave at some point in this country. And the physical distancing measures that we're putting in place now and some of these other measures will protect us from outbreaks, I hope, in the months ahead, but will also be in place to help protect us as we go into any second wave. And will likely be in place until our population has either a vaccine in place to give us some immunity, or we have a natural immunity to this virus because of spread. So I imagine that we will be doing some of these things for many months to come. And it's not how we would choose to live and work, but that is likely what we will have to do for some period of time. And remembering back to, well, I guess not remembering, but when we look back to the Spanish flu in 1917, schools were closed at that time in Prince Edward Island. Masks were being worn. And so in many ways, we're doing some of these same things more than 100 years later. But they didn't do it forever. It was for a period of time. The other question was about the discussion around the world about apps for contact tracing, and so that is a discussion we continue to have nationally. We're aware of some provinces like Alberta trying to put that in place, but it has its limitations and some concerns about it, but we're all certainly looking at that from across the country, and it may be something that we are at a very different stage to talk about by the time we have a second wave. So anyway, thank you all. Thank you very much.